Excellencies, Director General of WHO, Dr. Tedros, distinguished guests, advocates, participants from all over the world, ladies and gentlemen, greetings from WHO in Geneva. Thank you for joining us on this important day when we witness how the Director General's call to action translated into a global strategy and much more. We interacted with many people across all 6 regions of WHO and many partners and experts when we crafted this strategy. We interacted also with communities and partners from all over the world. We had clear recommendations from civil society, and we are grateful for everyone for this support. Today is important, not only because this is a concrete milestone for global health. Today is important because it is about the faces we often don't see, the people behind the statistics that we use every day. Today is also about the healthcare providers at the front line of service delivery. The global strategy will have absolutely no impact if the service delivery providers do not know or are unable to use the tools or have no access to the tools. The strategy will have no impact if we don't stop to listen to the voices of those we often do not hear. So today I welcome you and I ask everybody to watch, to listen, and be inspired. Thank you.
Tóth Icónak hívnak, Magyarországon, Budapesten élek. Egy szép családban, férjem van, és 2 csodálatos gyermekem.
Sally Gallo Kwenda. People call me, in Kenya we say daktari, which means doctor.
My name's Natasha Kickett. I'm a Gariada woman from the Pilbara. I'm a mum, 3 kids. I'm a wife.
Soy Marcela Silva, de la comunidad de mujeres viviendo con VIH de ISAW.
I am Kim Hilshan, and I am a mother of 2.
I'm a mother of 2 girls. I'm a local promoter of the fashion industry. I'm also a TV presenter and a radio presenter.
मेरा नाम गीता है और मैं मदनगिरी दिल्ली से ही रहने वाली हूँ। मेरे 3 बच्चे हैं।
Eu sou Daniele, moro em São Paulo, sou casada, tenho 2 filhas.
سلام، من ریحانه هستم، 33 سالمه.
I didn't really think there was anything wrong with me because I think whatever symptoms I may have had at the time, I sort of ignored them because they were not serious, you know, so I assumed it could be anything.
Amikor még ugye csak a tünetek voltak, akkor volt kismedencei fájdalmam.
When I went to see my doctor, she did a pap smear. So I went back 2 weeks later, and she called me in early, which is not good at a doctor's office, that when they call you in early. She called me in early and she said, "I'm sorry, I have bad news, it's cancer."
I was like, oh, right, okay. What about my kids? And it wasn't so much about worrying for myself and what it might mean for me, but more so just what it meant to my family and how it would affect them.
I was so shocked when this result came out positive because I wasn't having any pain or I wasn't having any symptoms, so it came as a big shocker. And especially now that my womb had to go was even worse.
خیلی حالم بد بود. خیلی گریه کردم، خیلی ناراحت بودم. اصلا فکرشو نمی‌کردم که همچین اتفاقی برام افتاده باشه.
I think I had a lot of questions, you know. I kept asking God, why me out of so many billions of women? Why did it have to be me?
क्योंकि मेरे छोटे-छोटे बच्चे हैं अभी, मैं तो मर जाऊँ मेरे बच्चों को छोड़ के।
Fue extraña la sensación, como que me costó un poco procesarla los primeros días. Dije, bueno, no creo que sea tan grave. En realidad era muy grave.
I had to wake up every morning at about 4:30 to rush to the hospital to get my radiation because there's so many people that are being treated at the same time. So if you want to get out of there quickly, you had to make sure you're among the first in line to get treated.
The treatment was very intense because it was 6 weeks she had to go to the hospital every day.
Another traumatic experience when after theater, my husband took off. And he said that he could not live with a woman who could not give him babies. And so he walked out of the marriage and he went looking for a woman who would give birth.
Part of my treatment plan was that I'd have 5 rounds of chemotherapy and 35 rounds of radiotherapy. That whole time was such a blur, and I don't think I've ever felt as tired in my life, trying to not be emotional about that, thinking that I can't even, buy food for my kids. It was horrible. Simple things that you just take for granted that you do as a mum, So,
And the whole of 2007, 2008 was 2 painful years. And I would say that all this time I was bedridden because it was surgery after another.
My body just wanted to sleep. I just wanted to rest. I couldn't eat.
Újra kellett tanulnom pisilni, a mai napig nem érzem a pisilési ingert. Haspréssel ürítek, és az órát kell figyelnem. Nagyjából tudom azt, hogy 2 óra alatt telik meg a hólyagom, és utána el kell mennem.
Que vienen siendo 44 sesiones de radiación y la braqueterapia que no la pudieron hacer porque mi interior estaba demasiado dañado, quemado, no me podían poner espéculo, el dolor era espantoso.
रेडियोथेरेपी से बाल उड़ गए थे तो मैं शीशा में देखती थी, आईना में तो बहुत रोती थी, बच्चे उनसे छुप छुप के, क्यों बच्चे भी घबराते थे मेरे को देख के.
حالم بد میشد، بارها تصمیم گرفته بودم خودکشی کنم، ولی خب یه سری آدم همیشه هستن که باعث میشن که بهت کمک کنن و منبع حمایت میشن برام.
Pero también pienso que el VIH y el cáncer te empobrece y te condena doblemente.
Hoje em dia eu ouço muito mais o meu corpo, eu presto muito mais atenção no que pode estar errado.
I must say that at some point I got so numb, but again I stood and said, I fell, but I'm not going to remain on the ground, so I'll stand. And that's why in one of my shots I say I'm still standing, and I believe I'm still strong.
At one point, I kind of noticed maybe it's good for me also to talk about it. And that's when I started working for OLEF, which is a patient advocacy group in the Netherlands.
I told myself, when I'm done with treatment, I'm going to make sure I'll be the voice that is going to go out and just shout from the rooftops and encourage all the women to get screened.
Az egész betegség teljes mértékben megváltoztatta az életemet. Nyilván ennek vannak rossz oldalai is, de vannak pozitív oldalai is. Azt szoktam mondani, hogy az ég sokkal kékebb és a fű sokkal zöldebb. Nagyon büszke vagyok erre az útra, és nagyon örülök annak, hogy sok-sok nőnek tudunk segíteni.
If you get screened early, this is a disease that is preventable and it is curable.
I had my screening test and it saved my life.
I am proud
to launch the global strategy
to eliminate cervical cancer.
Thank you. I am now honored to introduce our Director General, Dr. Tedros.
Thank you, Nana. Your Excellency, Janet Kagame, First Lady of the Republic of Rwanda, Your Excellency Dr. Shepo Ramaphosa, First Lady of the Republic of South Africa, Excellencies, dear colleagues and friends, it's a great honor to welcome you all to the launch of the global strategy for accelerating the elimination of cervical cancer as a public health problem. Listening to the moving testimonies of women who have survived cervical cancer is a sobering reminder of the devastating effects of this disease. I would like to thank these brave and strong women for sharing their journeys with us. Your courage and resilience are an inspiration and highlight why the elimination of cervical cancer is so important. And yet, we know that for every survivor, there are many other women who are not here to tell their stories. Every year, we lose more than 300,000 women to a disease which is almost entirely preventable and potentially curable if diagnosed early. We have the tools to make cervical cancer history. This is a historic moment for global health. It marks the first time that the world has committed to eliminating a cancer. The WHO strategy to eliminate cervical cancer recognized that we need to join hands across borders, sectors, and economic divides to improve the lives of millions of women and girls around the world. We know that while many countries have the resources and tools to prevent and control cervical cancer, there are marginalized communities with limited or no access to health services. It is our responsibility to continue to advocate for access to high-quality health services for all, regardless of where they live. The world has the knowledge and the tools to stop the spread of this killer disease. But this can only be achieved through political commitment, sustainable public-private partnerships, committed healthcare providers, and caring communities. And we must remember that effective services to prevent and treat cervical cancer can only be delivered by strong health systems built on the foundation of primary health care as part of every country's journey towards universal health coverage. 2020 has indeed been a defining moment for humanity, from confronting a global health crisis of unprecedented scale and depth to rising in solidarity against racism and social injustice, to uniting for a healthier climate and world. We're learning that we can act in solidarity as a global community, and that advancing the rights and health of all people, particularly the most marginalized, is our shared responsibility. With the same urgency, determination, and solidarity, we can create a future free of cervical cancer and a healthier, safer, fairer world for all of us. I thank you. Murakoze Chane.
Thank you, Dr. Tedros. As you noted in your remarks, it's a historic moment, and it's one that's reflected in the participation all over the world today as countries, communities have been lighting up their landmarks and their monuments in the color teal, which is the color for cervical cancer. And today it's not just the color for cervical cancer awareness, but for cervical cancer elimination. Those lightings have already started in some of the later time zones in places such as Japan and Australia, and as evening arrives, we hope you'll enjoy looking out for more in your area. So for now, we'd like to share with you a glimpse of some of the monuments that have already been lighting up today. A number of special guests will be joining us throughout the program from around the world, including a number of survivors and advocates for cervical cancer. But to get us started, we have the honor of introducing the First Lady of Rwanda, Her Excellency Jeannette Kagame.
Excellency Tsepo Motsepe, First Lady of South Africa, Your Royal Highness Princess Dina Mired of Jordan, Dr. Tedros Adhanom Ghebreyesus, Director General of the WHO, Dr. Susanna Jacob, Deputy Director General of the WHO, esteemed speakers, distinguished ladies and gentlemen. It's an honor for me to join you all today as we launch the global strategy to accelerate the elimination of cervical cancer. First and foremost, I would like to pay tribute to the women whose lives we have lost and to those who are suffering the consequences of what is now known as a preventable and curable disease when detected early and managed effectively. In May 2018, the WHO, under the able leadership of its Director General, Dr. Tedros Ghebreyesus, issued a global call for the eradication of the cervical cancer, noting that while the world had the knowledge and tools to address this preventable disease, women in developing countries continue to succumb to this disease at a disproportional rate. Up to 93% of cervical cancers are preventable, but today cervical cancer is the second largest killer of women in low and middle income countries after breast cancer. And this is unacceptable when taking into account the available technology, policies and cost-effective measures for early diagnosis and treatment. The HPV vaccine, Gardasil 9, has proven to be highly effective if administered before a girl or a woman is exposed to the virus. In Rwanda, the HPV vaccine was introduced in 2011, pushing us to initiate a countrywide strategy to fully implement WHO-recommended program to screen, treat, and vaccinate targeted population groups. We can attribute our success to a collaborative effort between leaders and community health workers at the national and grassroots level. Building on and leveraging the trust of the community in the public health system resulted in a successful implementation of the HPV program. Today, the vaccine is included in the national immunization regimen for children. Ladies and gentlemen, with the knowledge and access at our disposal, we owe it to women and young girls to play an active role in accelerating the elimination of this cancer. But there are still challenges ahead that warrant our urgent attention, and that is the critical role and responsibility of men in reducing the incidence of cervical cancer. Indeed, to this day, cervical cancer information, prevention and care programs have been gendered because of the media coverage, and to a certain extent, the medical system as well have focused on sensitizing girls and women, thus delaying men involvement in and accountability. Although HPV is the most common viral infection transmitted through sexual intercourse, HPV-related cancers are not common in men, as it is in women who are more likely to develop cervical cancer. But to this day, there is limited knowledge of HPV among men, which comes with the risk of undermining the progress made so far. This is especially true of cultural settings where women are still striving for their full sexual and reproductive rights. Hence, male partners must be actively involved in the cervical cancer prevention process by increasing their awareness about the disease and its transmission, protecting their partners from HPV infections. But also to ensure that at a young age, boys just like young girls are systematically vaccinated. Until then, the best prevention to protect women against this cancer will continue to be the use of condoms. Again, like most adversities, the burden of the responsibility continues to weigh heavily on women. Rwanda's case and success in creating awareness at the highest level, as well as mobilizing communities to adopt appropriate health measures against this cancer, is proof that the change and the progress we want is possible in every country. To the women who have shared their experience in overcoming the hardest road to recovery from cervical cancer, and to the many more they represent, I want you to know that we hear you and see you. Events such as this launched today will echo your plea to be protected from such a preventable and treatable cancer. I want you to know that we will continue to fight with you, and I thank you for your kind attention.
Cervical cancer is a deadly disease. It almost claimed my life. And I must tell you, here in my country, a lot of women are dying from cervical cancer. So all I want to say is it's not easy because, one, financially, it drains you. It's very expensive. You can imagine one who lives in a rural area coming to the city to access treatment needs transport. And here's a person even who lives in town who's supposed to start treatment, who needs to commute. It's very expensive. Whether you have money or not, it will just kind of drain you because it's very expensive for some people who live far away to come to Lusaka to access treatment. And the other thing, there are a lot of myths and misconceptions in my country where I live because a lot of people have all sorts of stories about cervical cancer. So all that makes family, even those close friends who want to look after you, to run away from you, to shun you because of the myths and misconceptions. It's not easy as a woman to suffer from cervical cancer. But here I am. All I can tell you is that this time I fought cervical cancer. I am fine, not because of my own strength, but because the Lord Almighty wanted me to live. And to the doctors, they are working tirelessly around the globe to end women cancers. And I salute you and I say thank you so much.
Now joining us is the First Lady of South Africa, Her Excellency Dr. Tsepo Ramaphosa.
Thank you. Your Excellency Janet Kagame, Your Royal Highness Princess Dina Miret, the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, heads of United Nations agencies, co-chairs of the Expert Advisory Group for Cervical Cancer, the Lex family, cancer survivors and advocates who are with us, and many others who are watching this event from all over the world. Distinguished guests, ladies and gentlemen, it is a great honor for me to join you for the launch of the global strategy to accelerate the elimination of cervical cancer as a public health problem. This is an important milestone in global health that has galvanized the cancer community. It gives hope for a better future for girls and women, a future free from cervical cancer. I want to start by acknowledging and celebrating the resilience and bravery shown by the women who have shared their stories with us today, and many others across the world who have also survived cervical cancer. Today, we also pay homage to those who have succumbed to this preventable disease. We congratulate Dr. Tedros for issuing the call to action and the World Health Organization member states for adopting the global strategy during the 73rd Health Assembly. We also congratulate partners who have supported the call to action and healthcare providers who undoubtedly feel relieved to know that there is something they can offer to women who seek care for cervical cancer. For decades, women have fought for the right to self-determination in almost all aspects of their lives. The right to autonomy over their bodies, the right to be recognized as credible leaders, the right to participate in economic activities and development efforts as equal and credible partners. All this while continuing to build our families and the communities we live. Many reports which are published on women's health and development paint a big future for women. For example, the Gender Gap Report published by the World Economic Forum highlights that it will take a century for the world to achieve gender equality. The COVID-19 pandemic has also exposed the inequities that have existed in our countries and society. Assessments of COVID-19 impact shows that women have been disproportionately affected by this unprecedented crisis. Despite all these negative and discouraging reviews and the ongoing efforts to erode women's rights, women continue to rise. Women are represented across all sectors of the economy. They lead institutions of higher learning. They manage both public and private medical establishments. They excel in sports. The list is endless. Most importantly, They are resistant with a huge capacity for compassion. As we launch the strategy, we are accompanied by strong, heroic women who are excellent examples of grit and determination. By sharing their experiences, they inspire us and encourage us. I hope those who are watching and listening from afar are also inspired and empowered to take the necessary steps to take care of their health. In the face of great difficulty, they have made a choice. They chose life and were determined not to let cervical cancer determine their destinies. They are stirring up the hopes in the hearts of those who fear an encounter with the healthcare system, inspiring those who are facing many different health problems, and reminding us never to give up. The adoption of the strategy is a significant first step. The bigger question, however, is deciding, are we going to contribute to the Elimination Initiative? Like our heroes here, we must be bold and use the positions we occupy, the network we have established, and the influence we have to ensure that the strategy does not become another unfulfilled promise. We want a better life for young people and future generations. One way to secure their future being is by ensuring that they have access to comprehensive health promotion and preventative services, including the human papilloma virus vaccination, among others. Healthy young people are better prepared for knowledge and education, with greater prospect for acquiring skills to navigate a better future for themselves. The global strategy articulates what needs to be done, raise awareness and advocate at the highest level to keep the health and well-being of women and girls at the center of development agenda. We have to advocate for equitable access to prevention and treatment services for cervical cancer for women across the globe, especially for those in low and middle income countries and women in vulnerable, marginalized communities. We must advocate for higher quality people-centered services and well-trained and adequately paid healthcare providers. The World Health Organization, under the leadership of the Director General, has led the global response to the COVID-19 pandemic with technical expertise and speed. We acknowledge this guidance, and countries are doing the best they can to save lives and secure livelihoods. The World Health Organization has also urged countries to re-establish essential services as speedily and safely as possible. Screening and treatment services for cervical cancers, other cancers, sexual and reproductive health, including HIV care, must be prioritized, re-established, and strengthened. We cannot delay, as each day lost decreases the chance of recovery for women who unknowingly have pre-cancer. By adopting the global strategy, the World Health Assembly has affirmed the commitment to the health of girls and women. It is now our turn to take the mantle and push forward with conviction. We have a clear roadmap. A lot of work lies ahead. Let us move ahead with implementation. I salute cancer survivors all over the world. Your fight is recognized, for in its difficulty, you overcame with triumph. I thank you.
Thank you so much, Your Excellency. I'm sorry I failed to recognize the presence of Her Royal Highness Princess Dina Mered of Jordan when I made my speech. So I just would like to announce that she is with us. And Your Royal Highness, thank you so much for joining, and thank you for your leadership. Richard, back to you.
Thank you. So now we wanted to share with you some of the activities that have been happening around the world today, celebrating the launch in countries and regions. As soon as we had shared that today would be the day that the global strategy was launched, we were amazed by how communities and countries started to turn words into action. And so today, while we're here, we also know that many of you have organized advocacy events, screening campaigns, trainings. So we'll share throughout the program a number of these as we go around the world, following more or less the course of the sun. So we'll start in the east to see some of the activities happening today in the Western Pacific region, in the Southeast Asia region, and also in the European region.
Cancer Council researchers have been working with the WHO to support the launch of the major strategic plan for cervical cancer elimination, which is being launched today.
I think we can be very proud as Australians that we were in fact the first country in the world to attempt a mass vaccination program with HPV vaccine.
The impact of this globally is that we can now demonstrate to the world at large how effective the vaccines actually are, because the burden of disease caused by these papillomaviruses in Australia has just disappeared over the course of the last 10 years.
I'm grateful for the Australian HPV vaccination program, as it means cervical cancer will be eliminated in my lifetime.
These tests are more sensitive for the detection of precancerous abnormalities and therefore more effective.
I'm grateful that I've had the HPV vaccine this year because it's one less thing for me to worry about when I'm older.
Elimination is possible for Aboriginal and Torres Strait Islander women, but it requires concerted efforts from all sectors of the health system to address long-standing and known structural barriers.
I feel that more people will not have to go through what I went through, which was having cancer.
We are coming to you from AIIMS New Delhi today, reporting on a day packed with activities throughout India. A national workshop was organized with participation of representatives of all major stakeholders: WHO, Niti Aayog, the Ministry of Health, research organizations, ICMR and DBT, professional and academic organizations, FOGC, partner organizations sharing experiences of state-level projects to overcome implementation challenges, awareness and screening programs in hospitals. Women learnt about HPV testing, self-sampling, and the prior methods of PAP and VIA. Teal, the color of cervical cancer, was in focus as doctors and health workers donned this color and sported ribbons for awareness. Webinars were conducted to enhance awareness in laypersons and health journalists. The Rotary Club of Coimbatore supported screening camps and awareness on buses. FOGC collaborated with FIGO to conduct countrywide competition on essays, posters and slogans. An enthusiastic response from doctors, nurses, health workers and students. The webinar was attended by over 10,000 gynecologists discussing adoption of new technologies and strategies to develop a roadmap for elimination.
We're really delighted to have come together and join this global day of elimination. Rob is going to talk you through some of the exciting activities and ways that we're coming together on the day.
We're going to continue to raise the profile of the strategy over the coming months. We're aiming to get tables questioned in each country in the Parliament, as well as getting ministers and the people such as All Party Group on Cancer to show their support. What's really exciting is that we're going to have cities such as London and Edinburgh are going to be lit up to show their support for this important day.
It's a more important time than ever for this agenda. Governments across the UK must protect cervical cancer services through the current and any future peaks of the COVID-19 pandemic. As UK charities, we also recognise the importance of collaborating with others across the globe to help support implementation of the WHO global strategy in low and middle income countries, where there are the greatest number of deaths.
I am a single mom, and the hardest thing about being diagnosed with cervical cancer was the fear of my children losing their mother, and that I would not be able to raise them anymore. So it was really hard for me to tell them, I did not even go home after I was diagnosed, but I went to work because I did not want to cry in front of them. So when I felt I was able to, I went back home and I told them. My daughter asked me, "Mom, can you promise me that you're not going to die?" And that really broke my heart because I could not promise that because I had no idea what was going to happen. Right now, it's 7 years later, and I'm really glad I survived for me and my children. Women are so important in their children's lives and in society as a whole. So hopefully, due to this campaign, not one child will lose their mother anymore from cervical cancer.
Now joining us is a longtime advocate for cervical cancer elimination and a member of the Director General's Expert Group on Cervical Cancer Elimination, Her Royal Highness Princess Dina Mered.
Dr. Tedros, Princess Nono Semella, Your Excellencies, First Ladies, my dear friend Janet Kagame and Dr. Chepo Ramaphosa, distinguished guests, and most of all, our wonderful survivors. Today is a great day, actually an exceptional, hopeful, audacious day for humanity, justice, and equity. Today is the day we tell cervical cancer loud and clear that your days are numbered. Cervical cancer, we have let you run wild, causing much destruction and grief to hundreds of thousands of our women and their families for far too long. We have let you prey on our most vulnerable, HIV-infected women, the poor, and the marginalized amongst us. We have let you weaken our resolve and defied our efforts. And we have let you take our women at their prime away from their children and families. And the worst part is you managed to do all of that, not because you were super smart, but simply because we let you. We opened the door for you and let you infect our girls and women, despite the fact that there was a vaccine that can block your entry from the word go. We placed alarm systems only for the privileged few amongst us, those who could afford to screen and early detect your stealthy movements. And worst of all, if you did manage to still break and enter, we let you do your thing unchallenged, leaving our women alone in pain and bleeding to death. We made it easy for you. But not after today, because today we have a plan, a solid plan to put you back where you belong, to relegate you to the annals of history, where no one will hear about you nor your whereabouts. Yes, we have a plan, a solid plan with an unbreakable code of unity, action, and ethics. We are going to block you from the word go as we will roll out a vaccine so powerful and so affordable and accessible that will send you packing. And if by any lucky chance you do manage to enter, you will be found at the doorstep and you will be dealt with and weakened before you manage to do significant damage. And for those who unfortunately are suffering your doings now, they will be now armed to fight you with affordable and accessible surgery, chemotherapy, and radiotherapy. And for those women who unfortunately succumbed to your poison, we will be there with them fighting stigma and holding their hands. And those who survived you to tell their tale, we will honor and celebrate them today and every day. Yes, we will be waiting for you at every nook and cranny, and we will find you and be ahead of you every step of the way. I can hear you laugh at our plan. You say that we have known about the solutions before, but you still got away with it. You say we don't have sustainable funds to implement our plan. You say we have too much on our plate and not enough focus. Apparently, another friend of yours from the COVID family, I hear, has taken the limelight and the resources so you can continue your deadly ways in its shadow. Well, I have bad news for you. This time it is for real. You see, like I said before, we have a solid plan and a comprehensive global strategy. We will not let your friend COVID take the limelight from you On the contrary, we will adapt our health systems to be able to fight both you, COVID, and other diseases. We have found the error of our ways. We are going to transform our global health and donor systems from treating our people or patients as diseases or donor projects to actual people with hopes and dreams. And we will be efficient and logical this time, making sure that a diabetic woman with HIV presenting at a clinic, for example, can also be checked for cervical and breast cancer. We have also committed to pool our efforts and funds to fight you. We have committed to prepare our complete arsenal ahead of time: vaccines, innovative screening and diagnostic equipment, early detection, treatment, and palliative care. What's more, we are completely united now. All of us, governments, WHO, global funders, civil society, private sector, global distributors, and the largest union for international cancer control, UICC, is right behind this effort as well. 194 countries signed on the dotted line with an unbreakable promise to our sisters, mothers, friends, daughters, that we will not let them down this time. And we understand that by adopting this strategy, we are committed to implementation and action. And this time, we also understand we are launching the plan in front of the whole world by branding you as one of the world's public health problems. You cannot hide anymore. We will send you to where you belong, to the annals of history. Hallelujah, today is a great day. Thank you very much.
I got infected with HIV in the 90s when stigma was very high. And during that time, there was no mother-to-child transmission intervention like it is now. So I lost 2 babies, and my husband also died. As if that was not enough, I was diagnosed with stage 2 cervical cancer. And we are told that a big percentage of cervical cancer is sexually transmitted. And I wish that the policy makers could do something about this, because so many women are losing their lives every day. I'm privileged to speak on behalf of the many other women out there who have survived. And so I would wish that in the comprehensive care for HIV, cervical cancer should be included.
Now, to speak about the double burden of HIV and cervical cancer, from UNAIDS, the Deputy Executive Director, Dr. Shannon Hayter.
Thank you very much. Your Excellencies, Her Royal Highness, colleagues, friends, advocates and bold voices, congratulations to Dr. Tedros and WHO on this very, very important day, launching a very, very important plan. And Sally Kwenda, thank you for your bold voice and your modeling and spreading the word. To all survivors, the HIV movement is by your side in the fight to make cervical cancer history. Partnerships like the Go Further partnership show that when we come together, rapid scaling up of cervical cancer screening and treatment integrated with HIV services can save millions of women's lives. We are only at the beginning of this, and we have far to go. Worldwide, an estimated 5% of all cervical cancer is attributable to HIV, but in countries with the highest rates of HIV, like some in sub-Saharan Africa, as many as 50% of cervical cancer cases are reported among women living with HIV. Women living with HIV are 6 times more likely to develop cervical cancer, and they develop it at a younger age than those without HIV. This speaks to the stark disparities in cervical cancer burden in the world, and particularly the double burden associated with HIV. Our struggles are intertwined in another vital way: inequality. HIV and cervical cancer are both diseases of inequalities. The health technologies and interventions which can save millions of lives will not fulfill their potential unless we confront the inequalities which drive vulnerability and block access. So together and today we say no to shame, no to stigma, no to disempowerment. In a survey in Swaziland, for example, 63% of men and 58% of women agreed that women had to seek permission from the male partner to visit a healthcare center. And 48% of respondents believe that only a woman with multiple partners got cervical cancer. We must together tackle misinformation and prejudice about infection. We need to support grassroots women-led movements, their insistence that there's nothing shameful about our biology and that no woman needs permission from a man to access health care. Today, we must say no to privileging men over women. We need to insist that globally, research and treatment of conditions that affect women secure prioritization and funding. Some of the technologies, such as rapid self-screening for HPV, need urgency and investments that match women's need for game-changing technologies. Today, we say no to accepting that poor must do without. We see differences between higher income and lower income countries. Women in Eastern and Southern Africa are 10 times more likely to die of cervical cancer compared to women in Western Europe or Australia. Internationally, 90% of girls in high-income countries have access to the HPV vaccine, yet in low and middle-income countries, just 10% have access. We also see inequalities within countries. In Malawi, for example, the poorest women living with HIV are 15 times less likely than the richest women living with HIV to get cervical cancer screening. Also, in too many countries with the highest HIV and cervical cancer burdens, women with invasive and late stages of cervical cancer have no access to advanced care, to radiotherapy, chemotherapy, or palliative care. We must demand a continuum of services that offer hope to women. And today we also say yes. We say yes to healthcare as a human right. Investments must be dramatically stepped up, barriers fully removed, services organized not only for, but with and led by communities of women. We cannot stay at the margins. This is the moment to be bold. We are with you and we are grateful for today. Thank you.
And now we'll continue our tour around the world to see some of the activities that are taking place today to celebrate the launch in the Africa region. And to get us started, we have the honor of going to Lesotho, where Her Majesty, the Queen of Lesotho, is kicking off a march against cervical cancer.
Today in Maseru, Lesotho, we join the rest of the world in the official launch of the global strategy for the elimination of cervical cancer as a public health problem. Cervical cancer is the most common cancer among women globally, with an estimated 570,000 new cases and 311 deaths worldwide reported in 2018. It ranks as the most common cause of cancer deaths among women aged 15 to 44 years globally. The highest regional incidence and mortality rates are sadly in Africa, which Lesotho is part of. In Lesotho, cervical cancer is the most common cancer among women and accounts for about 44% of all cancer cases in the country. In 2018, Lesotho reported an incidence of cervical cancer of 52.1 per 100,000 women population and a mortality rate of 39.1%. Implementing a robust cervical cancer prevention and control program ensures that the country is on the right path to join the world in achieving elimination of cervical cancer. Lesotho has started strengthening the primary prevention efforts by planning for national reintroduction of the HPV vaccine for their 9 to 14-year-old girls in 2022. Furthermore, screening services are now available at all health facilities in the country. In conclusion, the global strategy will assist the government of Lesotho in reducing poverty, sustaining access to education, improving child health, and empowering women. With sufficient political will and resources, elimination of cervical cancer is possible and can be achieved. We are now joining the march for elimination of cervical cancer. Khozo Bula Nala.
Hello, my name is Natasha Kawanda and I am a Teal sister. Today we welcome you to Zambia to support the global launch to accelerate the elimination of cervical cancer. We are screening female inmates in 5 different prisons today. We have our teams in Livingston, Lusaka, Choma, Kitwe, and Mazabuka. We will be screening the rest of the prisons in the country in the next few months. We are proud to be part of this initiative because as Teal sisters, we believe together we can eliminate cervical cancer. Teal sisters for life.
Uyalalela usomandla noma isimo singavu uyalalelwa uyalalelwa usoma noma isimo singavu uyalalelwa uyalalelwa usoma noma isimo
We, the Hillcrest AIDS Center Trust South Africa, are proud to support the global strategy to eliminate cervical cancer.
Jerusalema ikhaya lami ilondoloze uhambe nami zungangishilana.
Following the call to action to eliminate cervical cancer in 2018, the Director General established an expert group on cervical cancer elimination. The group is co-chaired by Professor Sinaid Fiseha and Professor Grosbeck-Parham. We now would like to welcome Professor Sinaid.
Greetings. I'm really glad to be at this seminal event along so many esteemed colleagues, including Her Excellencies, the First Ladies of Rwanda and South Africa, Her Royal Highness Dina, my dear friend, Dr. Tedros, survivors, advocates, health experts, heads of agencies, member states, and all other distinguished guests. I'm really honored to speak at the co-chair of the Director General's Expert Advisory Group on Cervical Cancer Elimination. I particularly feel privileged to share this platform with the LACS family. Thank you for being here. Let us continue to honor the memories of Henrietta Lacks by fighting to ensure that human dignity and human rights are at the very center of our work as researchers, providers, and advocates. And truly recognizing we have dark histories here to overcome. So we must remember that on this historic day, the day that the world has committed to eliminate cervical cancer. I'm also enormously grateful for the incredible leadership at the WHO, particularly that of Dr. Tedros's and that of Nono Simelalas, as well as the courageous women who are sharing their stories, the relentless healthcare workers who, despite the challenges, show up every day to take care of patients, even when it means they are putting their lives at risk, as we have seen with COVID-19 pandemic. This is a major moment in global health, and one that we should be very, very proud of. Cervical cancer, as you've heard already, is a highly preventable disease, and yet still kills more than 300,000 people each year, the vast majority living in low and middle income countries. This is a health issue we should care about. We have an HPV vaccine, we have screening, we have the tools, and we now have the strategy and the roadmap to stop it. Take Rwanda, for example, where cervical cancer was the most common cancer among women. More than 3.5 million people were at risk of this disease. Now, 93% of girls receive the HPV vaccine, protecting the next generation. That's why not just roadmaps, not just strategies, but also leadership matters. WHO's global strategy to accelerate the elimination of cervical cancer launching today outlines 3 key steps: vaccination, screening, and treatment. Successful implementation of all these 3 could help us reduce more than 40% of new cases of the disease and 5 million related deaths by 2050. So this is a moment of significance, not only because it's first, but because that first represents a commitment to centering the needs of women and girls, valuing their bodies and their lives, a necessary step towards a brighter future for all people. In the best of times, women's rights and voices are often ignored, especially women in low-income countries, as well as young women. And women of color in higher income countries. Think about Henrietta Lacks. And in times of crisis, like the moment we are living in right now, it's even worse. Women are bearing the disproportionate burden. As I speak, women and girls around the world are facing a number of deadly crises in parallel to COVID-19, and made much worse by it, namely restriction and attacks on essential healthcare, including sexual and reproductive health and rights, increased gender-based violence, and mental health crisis from the crushing responsibility currently expected of them. So now when we talk about sexual and reproductive rights, we are talking about a diverse and comprehensive set of health services needed across a lifetime, from HPV vaccination to menstrual hygiene to sex education, routine screening, access to contraception, safe abortion, and maternal health. Because SRHR services often have been deemed non-essential in this pandemic, we've already seen a range of harmful impacts from an increase in gender-based violence and adolescents' unwanted pregnancy, early marriage, and increase in unsafe abortion. The statistics we already see and the projections of what is to come are staggering and sobering. What is worse is because we lack data on how many women have missed much needed care, like cancer screening, many more women's lives are at risk. The pandemic is just the most recent examples of what happened when we don't center the rights of women and girls from the start. Let me be clear. Cervical cancer affects everyone. For example, HPV is the leading cause of cervical cancer, can infect young men and boys as well, making it important for everyone to get vaccinated. All people, regardless of their gender identity, have a stake in ending cervical cancer. We can end cervical cancer, so we must. It is time to act And I'm pleased the WHO, in partnership with member states, academic institutions, civil society, UN agencies, and others, is leading this charge. I'm really hopeful for a future that is free of cervical cancer and for a world where every person has more control over their own body. I'm enormously grateful for Dr. Tedros' leadership, but I also would like to acknowledge the Director General's Expert Advisory Group on Cervical Cancer Elimination for this outstanding job, taking charge and delivering. Thank you and have a very successful launching event.
Nna o ke hao ne ke treatela cancer ka 2014 ya cervical cancer. Mme ke na ka hela ke fentse ke hodile. Ke bona e le boitumelo gore go fediswe bolwetse jo. Le ha tshela Botswana le nthusitse tota. Ke bone pholo ke itumetse ga ke na le mathata. Nna ke rotloetsa batsadi tota go ba mo malapeng gore ba tse bana ba bone ba itse go di primary mbe go kentelwa mokento wa go thibela cervical cancer ka gore bolwetse ba cervical cancer tota na ke itile mo go bonana ke itse botlhoko jwa bone gore ga o le monana bo tla wela ha ne ke etse teng nna ga ke batla go nna jalo ebe ke rotloetsa le ene motsadi gore motsadi wa ngwana ke motho wa mmelene a tsamaye a ye kokoka le ne go icheka a bona go na le change o khona bona ka life go no ka speed a ba thusiwa a bona ditlamelo a ba bona pholo a gagwe a ba siama.
Mr. Director General, Dr. Tedros, Your Excellencies, dear colleagues, ladies and gentlemen, I am delighted to join this launch of the global strategy to accelerate the elimination of cervical cancer. And I really want to thank you, Dr. Tedros and WHO, for your leadership. I am very happy and proud that despite the pandemic situation, we are still able to unite our forces to express our common and political determination to accelerate the elimination of cervical cancer. UNITED is a key player and is fully committed to this elimination. This cancer strikes the most vulnerable and poorest populations, and we cannot accept that women die when we know they could be saved. Cervical cancer is the fourth most common cancer in women and claims the life of one woman every 2 minutes. More than that, 90% of these women live in low and middle income countries. No woman or girl, irrespective of where they are born or where they live, should fall prey to cervical cancer. This situation is not acceptable, and that's why we don't accept it. We cannot see cervical cancer as a death sentence because it is one of the most preventable and treatable cancer. We cannot accept inequity because we have effective tools and solid policies. So why should we accept that in remote settings, progress has been held back by high costs, ineffective screening methods, and ill-adapted treatment services? In addition, we know cervical cancer has a very direct and concrete social impact on women's life, who play a crucial role within communities. Cervical cancer directly affects not only their health, but also their social commitment. Innovative solutions exist, and that's the good news. UNITED is the largest funder of innovative tools for detecting and removing precancerous lesions. Our objective is very clear: bring affordable, game-changing solutions so that women can be diagnosed and treated rapidly and efficiently wherever they are living. Our investments are focusing on transforming cervical cancer screening and treatment approach. While many countries are still using visual inspection for detection because it's the cheapest way, though not the most effective one, we are demonstrating that more accurate tests for detecting the virus will revolutionize the cervical cancer response. This is the case with the artificial intelligence-based screening tools and thermal ablation systems that will allow to deliver a screen and treat solution for less than $1 in low and middle income countries. That's good news. Innovation can save lives, but only if countries properly and concretely deploy these more affordable and effective solutions. And that is why we need to gather our forces and push a political and concrete mobilization. This global strategy we launched today is a very important political momentum and an historic milestone. The commitment of 194 countries give me great hope, but this cannot be confined to paper. I call on all countries, organizations, and partners to make our objectives a reality by fully engaging to concretely implement these solutions for the most vulnerable countries. I also want to warmly thank all the cities that are mobilized today by illuminating their buildings from the Paris City Hall to the Dubai frame. This is a great way to shed light on a very important and clear message to the world. Together, we can eliminate cervical cancer and save millions of women's lives.
My name is Ulrika Århed-Kågström, a member of the Board of Directors of the Union for International Cancer Control, UICC. I'm delighted to join this launch from Sweden and share with you the excitement in the global cancer community at the very first ever global commit to eliminate a cancer. UICC is uniquely placed to work with its diverse and global membership to drive national action. Civil society organizations, academic institutions and societies, many of whom are holding celebratory events, large and small, around the globe to mark the launch of the global strategy today. We commit to leveraging our convening platforms over the next 10 years to maintain a spotlight on cervical cancer elimination and progress towards achieving the 2030 targets in all countries. We commit to work closely with the World Health Organization to celebrate emerging best practice, innovations and recommendations for implementing and scale up of services at each event. The World Cancer Day, the World Cancer Leaders Summit coming up in October next year in Boston, and the World Cancer Congress in Geneva in 2022. UICC pledges to harness our convening role across sectors, serving as a facilitator for bringing the skills, expertise, and global reach of the private sector to accelerate progress. We will encourage willing parties to build multi-stakeholder partnerships that are focused on outcomes with regular reporting on learnings and impact. Dr. Tedros, we know that responding urgently to fill the health workforce gaps and build capacities across the 90-70-90 targets is critical, especially Pillar 3 on diagnosis, treatment, and palliative care. UICC fellowships that have been supporting the development of the research and clinical skills base for cancer control for over 50 years now will be made available to support national cervical cancer programs. UICC also stands ready to collaborate with others to ensure that technical assistance response is tailored to needs and available to those countries with the greatest burden. I would like to close by commending the leadership of Dr. Tedros and Dr. Simelela on this agenda item, and the WHO team and member states for establishing this formal launch of the global strategy, despite the challenges of the COVID-19 pandemic. UICC would like to note, however, how critical it is to have one day in the annual calendar where all three prongs of the global strategy come together and are considered as an intended holistic approach. We therefore propose that the 17th of November is adopted annually as an International Elimination Day to ensure we break down silent thinking and stay true to the ambition of an integrated solution. As Dr. Tedros says, to banish cervical cancer to the history book. UICC will add the expertise and reach of our global network to the 10 elimination days to 2030, being 10 steps in which we celebrate progress against this devastating cancer. Thank you for your attention.
Thank you, UNITAID, and thank you, UICC, for those commitments to cervical cancer elimination. And now we'll continue our tour of seeing some of the activities that are taking place in other countries by going next to Rwanda, where Dr. Francois Wenkindi from the Ministry of Health has been out at health facilities increasing cervical cancer services.
Warm greetings from Rwanda. We are celebrating this historical day in the elimination of cervical cancer. We are conducting different screening activities from different locations. Let us take you to one health center and one district hospital where activities are taking place.
We welcome you here at Remera Health Center, located in Gasabo district, where we have women who came for cervical cancer screening. As you can see here, we usually start by teaching them about cervical cancer, the benefit of screening, and the screening method used, among other things. To those consenting, we then conduct an HPV DNA sample collection. Women are given the freedom to choose between a self-sampling and a provider-initiated sampling. We are using an electronic medical records with OpenMRS using tablets to capture data. The same system is linked to the nearest district hospital where those samples will be taken and analyzed.
After preparation of sample, come here in the room of analysis. After we learn the sample.
Blandine Njira. Here we are at Yavega Health Center. Today we have a woman tested positive on HPV DNA test, coming back for results. A VIA test is conducted, and those with a positive VIA are treated with thermoablation machine right away. A woman with extensive lesion or suspected to have invasive cancer are referred to the district hospital for RIP and biopsy for further investigations and the treatment at teaching hospitals.
I welcome you all to this comprehensive cervical cancer training. The Ministry of Health has made a strong commitment to reducing the burden of cervical cancer in Malawi, and we are honored that this training is taking place as a companion event to the launch of the global strategy to accelerate the elimination of cervical cancer as a public health problem. The launch of this strategy represents a global movement, and in Malawi we are proud to be on the forefront to move this agenda forward.
Cervical cancer is preventable. Firstly, the motivation starts from educating the community or the women that come at the facility. When they are well motivated, they make informed choice to be screened for the cervical cancer. As a trainer, what I like most is women can easily access cervical cancer services wherever they are and wherever these providers are.
The First Ladies Against Cancer FLAC is a coalition of First Ladies, both current and former, of states in Nigeria, joined together by a common passion, which is cancer control. To increase awareness, to improve screening and diagnosis, and increase access to treatment for Nigerian patients across the country. In order to commemorate the launch of the World Health Organization Cervical Cancer Elimination Strategy, we are very happy to be here in Gwagwalada today to commission this ward for cancer patients. We hope that by doing this, we will be contributing towards the achievement of the 90-70-90 goals of the strategy to ensure women get screened and treated and girls get vaccinated against cervical cancer. We join others around the world in the support of cancer patients.
The Nigeria First Ladies Against Cancer, together with the Federal Ministry of Health, have been very strong advocates for the introduction of the HPV vaccine. And a key partner in that mission is Gavi, the Vaccine Alliance. So we go now to the CEO of Gavi, Dr. Seth Berkley.
It's a great pleasure to be here with you today. Immunization against HPV infection, coupled with screening and treatment, is the best strategy to reduce rapidly the burden of cervical cancer. In low-income countries where women often lack access to cancer screening and treatment services, immunizing girls before exposure to HPV is critical. HPV vaccines are safe and very effective and can prevent up to 90% of all cervical cancer cases. Thanks to the Vaccine Alliance, the lowest income countries now have access to HPV vaccines for as little as $4.50 per dose, with soon new suppliers at lower prices. By the end of 2020, it's expected that 14 million girls will have been vaccinated against HPV in 24 countries with support from Gavi. We had hoped to have it be 40 million, but the unprecedented uptake of HPV vaccination in Gavi-eligible countries, combined with the increased global demand for HPV vaccines from higher-income countries, has seen a significant supply shortage of HPV vaccines. Alliance partners have been working with manufacturers in order to increase manufacturing capacity to meet this high worldwide demand. The good news is that companies together announced that they will provide vaccines to reach 80 million girls in this next 5-year strategic period. As the strategy to eliminate cervical cancer strongly signals, few diseases reflect global inequalities as much as cancer of the cervix. To reach the vaccination target of 90% of all girls vaccinated by HPV by age 15 years, we must ensure sustainable pricing and supply of HPV vaccine is attainable for all countries and populations. The Alliance plans to continue to advocate for low-cost doses, campaign for increased manufacturing capacity, seek to support to bridge the pricing gaps for lower and lower middle-income countries, as well as work with countries to help them adapt programmatic strategies to accelerate vaccination. Today, the Alliance stands to support prevention and treatment of cervical cancer because as we have heard today, together we can make history. It is within our reach. Thank you.
Hello, my name is Frank Acosta. I'm a clinical psychologist and father to Jeanette Acosta. My daughter lost her life to the ravages of cervical cancer nearly 3 years ago. This is a devastating time for myself and for my family. During the year that Jeanette battled cervical cancer, she was determined to live. She valiantly accepted all treatments that were offered to her. It was an agony to see her go through so many treatments, surgeries, and hospitalizations. I tried to be as supportive as I could be during this time. I was close to her. She appreciated this. Jeanette accomplished a great deal by the age of 32. She had fought for social justice. As a new attorney, she was poised to fight again and again for social justice. I grieve her loss. For everyone watching, I ask that you please support all women and families in the fight to eliminate this disease. Thank you.
Cervical cancer is almost entirely preventable, and yet it remains one of the most common cancers in women and the leading cause of death from cancer among women in the developing countries where UNFPA works. These are women who shoulder the tragic burden of the disease, and the numbers are just staggering. Nearly 90% of cervical cancer deaths occur in low and middle income countries. Globally, the death toll from cervical cancer has nearly surpassed that of maternal deaths, and it does not have to be this way. Every woman and girl, every transgender man should be able to access health care to prevent, screen, and treat cervical cancer no matter where they live. UNFPA stands shoulder to shoulder with the World Health Organization and the coalition of partners. We are working together to accelerate the elimination of cervical cancer. And I'm really proud that we're a part of today's launch of the global strategy. Our aim should be nothing less than zero, an end to cervical cancer. And to do that, we need to get out there and tackle the barriers that stand in our way. And some of those barriers are raising greater awareness, strengthening health systems so that anyone anywhere can get access to HPV vaccine, as well as effective treatments, because these interventions save lives. Valentina is someone who told me that she'd been suffering intense pain in her pelvic area for a long time, but in her rural village in Ukraine, there was no gynecologist. So it was a UNFPA-supported mobile clinic where a specialist quickly diagnosed Valentina and treated her for a pre-cancerous condition. We at UNFPA will do all we can to continue the fight against cervical cancer. At the World Health Assembly, Dr. Tedros asserted that this is a cancer that can be eliminated as a public health problem. We do need to make this disease a disease of the past. It's a battle that we can win and that we must win. So let us all seize that opportunity now to make a difference in a woman or girl's life. Thank you.
Thank you very much. And now, from the Global Fund, we have Chief of Staff, Marijke Weinrocks.
Thank you very much. And the Global Fund is excited by the This is a historic event, as many other speakers have highlighted, and the energy in the virtual room is palpable. It's fantastic to see the real movement and advocacy moving for cervical cancer. Cervical cancer is a cancer that the world can now eliminate, as we have the momentum, the commitment, the partnership, the strategy, and the tools. We now need to move from words to action. If we seize the opportunities in front of us, girls who are born today will live to see a world free of cervical cancer. As Shannon Hader said, the HIV community is with you in this fight, and she gave you the compelling statistics. And as a leading institution fighting HIV/AIDS, the Global Fund recognizes the importance of strengthening the linkages between HIV programs and cervical cancer prevention, detection, and pre-cancer treatment. The commitment to support the screening and treatment of co-infections and comorbidities is anchored in the Global Fund's core investment policies. Since 2015, with the board decision on the policy for co-infection comorbidities, countries have been able to prioritize interventions for cervical cancer treatment and care for women living with HIV and HIV programs, and within our health systems grant, focus on integrated service delivery for sexual, reproductive, and adolescent health. Zambia was the first country to take advantage of the new policy, using its grant savings to finance cervical cancer prevention and treatment activities integrated in ART clinics. Since then, other countries have progressively prioritized such interventions. Thus, starting from a total investment of only 0.9 million in the 2016-2018 cycle, this increased to 3.3 million in the next cycle, and currently stands at almost 10 million based on the funding requests that have been submitted so far, and we're still counting. This wasn't always easy, as programs are very siloed in many countries, and despite the overwhelming evidence of the disproportionate burden of cervical cancer among women living with HIV, many people still lack awareness. But we are slowly overcoming these barriers and seeing increased energy and momentum. From our side, we've done our best to advocate and amplify opportunities for countries to include cervical cancer in their funding request to the Global Fund. For this new funding cycle, we included specific guidance to this effect in our Access to Funding Toolkit that countries use to guide the development of funding requests. For example, included in technical briefs on RMN-CAH and resilient and sustainable systems for health and HIV. In addition, we work closely with civil society and WHO and UNAIDS to develop and disseminate these messages during the country dialogues. We were really pleased to see the increased uptake by countries as a result of this joint effort. Even though it may appear that the Global Fund investments are modest relative to need, they are increasing and they can go a long way by catalytically leveraging existing country HIV SRHR platforms, leading to further resource mobilization from domestic resources and development partners for sustainable scale-up of national programs for elimination of cervical cancer. In closing, I would like to reiterate the points that other speakers made so eloquently about the underlying gender and equity dimensions that define women's vulnerabilities to cervical cancer. Cervical cancer is not just a health issue, it's fundamentally linked to social justice and women's rights, and we owe to all the girls and women to free the world of cervical cancer. Thank you.
Thank you, Marijke. We'll now conclude our tour of the events that are taking place around the world by seeing some of the activities to celebrate the launch in the Americas region.
El Salvador por primera vez en la historia cuenta con la vacunación para el virus del papiloma humano. Toda esta estrategia ha iniciado desde el 1 de noviembre, se va a estar aplicando a nivel nacional por diferentes estrategias a través de la búsqueda y el tamizaje comunitario, asimismo a la aplicación en diferentes de las instituciones del Sistema Integrado de Salud, con lo cual garantizamos de esta manera poder aplicar y generar esa protección contra el virus del papiloma humano y por supuesto limitar la posibilidad del cáncer de cervix en las mujeres salvadoreñas. Asimismo, no solo es esta estrategia, sino que también el incremento en el tamizaje que se está dando a nivel territorial en las diferentes dependencias e instituciones que dan provisión de servicios que forman parte del Sistema Integrado de Salud y también, por supuesto, la facilidad y el acceso con mayor cobertura para el tratamiento de las lesiones precancerosas. De esta manera podemos acercar a la población salvadoreña y específicamente a la mujer que da esa unidad en la familia, a esa persona que nos da la fortaleza y que nos mantiene a todos los salvadoreños unidos, nos da la posibilidad de garantizarle su salud y de disminuir la posibilidad de adquirir la enfermedad. Hay mucho por hacer, al igual que hemos trabajado y hemos liderado el manejo en la región en el contexto de la pandemia, vamos a seguir desarrollando nuestro sistema de salud para poder salir adelante.
Hello and welcome to the 16th Street Baptist Church. We are here in the place where change has occurred. In 1863, the 16th Street Baptist Church was founded as the first colored Baptist church. In 1963, change occurred when children marched out of the basement of the 16th Street Baptist Church into the streets where they faced dogs and hoses. In 1963 also, 4 little girls tragically lost their lives in the bombing of this church. We have always been on the front end of change, and now we're on the front end of change with the World Health Organization in their initiative to end cervical cancer.
I'm Dr. Cynthia Garrett from the 16th Street Baptist Church, part of the Health and Wellness Ministry. We're excited to take part in the celebration to end cervical cancer. Our event is hosting a webinar featuring Dr. Grosbeck Parham.
Good afternoon. My name is Grosbeck Parham. I am a physician, a gynecologic oncologist who lives and works in Lusaka, Zambia, but I also serve as the co-chair of the Director General's expert group on cervical cancer elimination. Dr. Tedros, and to all other distinguished guests and to others who are listening in today, it is truly an honor to be here and to serve in this position. But it is a double honor to follow my colleagues from the 16th Street Baptist Church, which actually is my home in Birmingham, Alabama. The 16th Street Baptist Church was ground zero of the historic and legendary fight of African Americans to end legalized racial apartheid in the 1960s. And I was one of the young children who marched out of that basement on May 2nd, 1963, against the dogs and the hose pipes of the police in Alabama, Birmingham. So I know that the backs of these evil, dark forces can be broken, but I also have an idea of what it takes. 25 years ago, back in 1995, I would sometimes visit the Medical University of South Africa. It was called Madunsa. It was a black university that was established to train black doctors in South Africa by the white apartheid government. So I would visit and work alongside a cancer surgeon like myself by the name of Dr. Letitia Moja. She was South Africa's first black female gynecologic oncologist, and I would work there to help her train young doctors how to surgically treat patients with cervical cancer. And I remember very vividly, even though it was some time ago, during one of my visits at the end of a long day of work, she turned in and she said to me, "Grossbeck, we've had a great day doing surgery together and discussing this horrible disease that haunts African women across the continent. But the more we talk about this disease, the more I realize that you and I are really not talking about the same thing when we talk about cervical cancer." So I was a bit stunned because I felt a cancer is a cancer, no matter whether you're in South Africa or Asia or Latin America. So what could she possibly mean? But she just looked at me and said, "Just keep coming back to Africa and working, and one day you will understand." So 10 years later, in 2005, I actually moved from the United States to Zambia to join the fight against cervical cancer as a foot soldier on the front lines. And I started moving around the country of Zambia with my Zambian colleagues, giving cancer screening talks in the peri-urban compounds and community centers and churches and mobile screening camps out in the rural villages, and where I met African chiefs and African traditional healers. And of course, the wonderful women and young girls who lived in these vast areas of very, very deep poverty. I also started participating in the day-to-day management as a surgeon of patients with cervical cancer back at the University of Zambia. And soon I realized what Dr. Moja had meant when she made that statement to me. What I had not understood and what she was alluding to was the social context of cervical cancer in low and middle income countries. And to really understand this disease and what it's going to take to eliminate it, and yes, we can, and yes, we will, but to eliminate it in low and middle income countries where it has its greatest burden, is going to require a broader and deeper understanding of its social context and how context actually operates to both create and perpetuate the circumstances that put women and girls at risk for the disease. What Dr. Moja was talking about, and what I finally realized, was some of the social determinants of cervical cancer in global settings where its incidence and the mortality rates are highest. What she was talking about were things like the daily struggle of women for food, clean water, and clothing. That's right. I said food, clean water, and clothing, a daily struggle for those basic necessities. The lack of decent housing, sewage and sanitation systems, problems that have been solved decades ago, sewage and sanitation systems. The absence of any protection from domestic violence and early childhood marriage, which can virtually imprison a girl for the rest of her life. And circumstances where sex can often be the only readily available means for a woman to generate income for herself and her family. That's what she meant by the fact when she said, that cervical cancer was different for me than it was for her, and I had not really understood the social context. As a Zambian cervical cancer survivor told me just the other day, and these were her words, we don't just die from the disease, Professor, but all the other factors that put us at risk for getting it in the first place. So can we eliminate cervical cancer? You've heard it. We can. We know enough and we have the tools. Will we eliminate cervical cancer? Yes, we will. If we stop operating first under the illusion that conferences, as important as they are, don't actually save lives. If we stop overemphasizing the importance of the screening test, and high-performance screening tests are important, but we have to stop overemphasizing the importance of the test itself as opposed to the system in which the test is incorporated and whether that system can be sustained in low and middle income environments. And we can and we will if we understand that governments, yes, must assume the leadership, but they can't do it alone. And also, we have to stop finally operating as individuals in silos and as academicians and as this and that and the other, and start moving as a global collective. And finally, we have to come to terms with the fact that the battle against this disease is actually a battle against the social injustices that put women and girls at risk for developing and dying of this disease. In addition to HPV vaccinations, which work and which are extremely safe, in addition to high-performance screening tests, in addition to surgery, chemotherapy, radiation, and palliation, all of which work, and we know they work. We have scientific evidence that they work. We have to also take up the fight against the actual social conditions that give rise to the disease. Else we may get rid of it, but somewhere down the line, it will rear its head again, maybe in different clothing, but just as deadly or deadlier. Now we will hear a message prepared for us by the family of Mrs. Henrietta Lax from Baltimore, Maryland.
Thank you for having me and my family here today. I'm David Lax Jr., son of David Sonny Lax and grandson of Henrietta Lax. You may know of my grandmother from her immortal healer cells that have led to some of the greatest medical breakthroughs of our time, like the polio vaccine and the HPV vaccination. Unfortunately, my grandmother died at the tender age of 31 from metastatic cervical cancer. Today, me and my family will share how we are coming together during our grandmother's centennial celebration to support strategies to eliminate cervical cancer.
I am Jerry Lax Y, the granddaughter of Henrietta Lax. David Sonny Lax is my dad, who is Henrietta's middle child. We use her story as a platform to advocate. When my daughters were younger, the doctor, their physician would ask, do you want your children to be vaccinated with the HPV vaccine? And I was like, no. And he would give me information about this vaccine. And he's saying, if you're not, you still can, I'm gonna give you the facts, but you still can look it up for yourself so you can feel comfortable of what this vaccine can help and do for young women and young men, because we wasn't comfortable. Family, my daughters and my mom, to go read more about the HPV vaccine and to make a decision, okay, whether the girls was going to get vaccinated with the HPV, because this is their body and they have to make that conscious decision if they want to take something to prevent them from getting cervical cancer. They did decide to do the HPV vaccine. Wonderful just to know that our grandmother has helped the world in tremendous ways. It just makes me want to advocate more and to make sure that people are aware of the importance of being vaccinated. Everyone's called to action to make sure that everyone has access to quality health care. I am supporting WHO strategy to eliminate cervical cancer because I think it's my duty as a descendant to work towards a common goal.
Thank you, Jerry, for bringing a profound topic on cervical cancer. As Jerry said, my name is Alfred Lax Carter Jr. I'm the son of Deborah Lax, the grandson of Henrietta Lax. My grandmother, Henrietta Lax, died at a very early age. She left behind a loving husband and 5 children. We must stand together and eradicate cervical cancer. And we stand together in solidarity with all women around the globe to ensure no other mother, sisters, or daughters die from this devastating disease. On behalf of the Lax family, we would like to thank the WHO, member states, and leaders around the world in medicine.
We've heard from so many inspiring advocates who have battled cervical cancer, survivors, families, allies. Thank you so much for sharing your stories. We'll now have a brief remark from Deputy Director General of WHO, Susanna Jakob.
Thank you very much, Excellencies, distinguished guests, advocates, survivors of cervical cancer, ladies and gentlemen. Today is indeed an important day for WHO, our partners in the UN and the global health community. The adoption of the global strategy for the elimination of cervical cancer has brought this preventable and curable cancer back into the spotlight. We now have a unique opportunity to contribute to better health for women and girls across the world. The development of this strategy is a very good example of our new operational model, which encourages cross-departmental collaboration and stronger alignment across the 3 levels of the organization. This launch event will be followed by the launch of a set of global public goods that will support member states during implementation. I would like to acknowledge the survivors who shared their experiences with us today. The messages you conveyed will strengthen our determination to support countries to achieve universal health coverage and to provide high-quality health services. We are committed to doing everything we can to support countries with access to all the tools required to address this cancer, including the HPV vaccine, which protects young girls. We will also continue with the development of additional global public goods and fulfill our role as a normative agency. Despite the challenging issues we face as we assist all countries to respond comprehensively and decisively to the COVID-19 pandemic, we have continued all the areas of work covered in our mandate. We have also continued to bring new developments to the attention of our member states. This strategy is an example of our determination to help countries continue to provide essential health services, especially for young girls, women, and those who remain extremely vulnerable. I thank you all for joining us today as we celebrate this important milestone in global health. And good luck to all of us in the implementation of this strategy. And thank you again for attending and for supporting us, supporting the countries, and supporting a good cause for global health. Thank you.
Thank you, Susanna. And now, to help us bring the event to a close, please welcome UNICEF Goodwill Ambassador and 4-time Grammy winner, Angelique Kidjo, and then Dr. Nono Simalela.
Dear Excellencies, ministers, and everyone who is joining us today from around the world, it's an honor to participate in today's historic milestone as we launch the global strategy to eliminate cervical cancer. This is not just any cancer, it disproportionately affects women and girls, and it most often affects women at the peak of their productive life, affecting their family, their community, and national economies. I was born and raised in Benin, West Africa. That's why I'm particularly interested in advocating to eliminate a cancer that represents an injustice for the global South. 9 out of 10 deaths from cervical cancer occur in the poorest part of the globe. But between 2006 and 2017, those countries received less than 10% of the world HPV vaccine doses. Undersupplied and overpriced vaccines in diagnosis are costing lives. As a long-time UNICEF Goodwill Ambassador, I've seen firsthand the life-saving miracle of vaccinations. UNICEF even provided my vaccination when I was a child. Vaccine have eradicated diseases like smallpox and substantially reduced death due to measles and tetanus, and most recently have helped us wipe off Africa polio because of vaccine. 1 woman dies every 2 minutes of cervical cancer, and these diseases are almost all avoidable. That's why no girl should be denied access to a life-saving vaccine. We need school-based health program and other vaccination service to ensure that every girl is given the foundation of health, real good health for her life. Nobody should be denied the health literacy to take charge of her body, nor made to feel ashamed to seek medical help that can save her life, and should not be denied access to life-saving services only because her health has been stigmatized and deprioritized. That's why today is also an opportunity to open a new front in the battle to redefine our health systems, our education system in ways that give equal value to the status of girls and women. And men also need to learn so that they support their daughter, the mothers, wives, sisters in their lives. My father has been a force in my life. My father will stood against any tradition that could harm us all. My father is an African man that invests in his children, that believe that if we go to school, we can make a difference, that we have to speak up to fight for our right, that our body as girls are not merchandises, and we cannot, absolutely cannot, whoever we are, decide what the fate of girls should be. I've heard so many horror stories about cancer in Africa from friends and from women when I'm traveling. Breast ablation, men don't want the women back. What is wrong that we cannot in Africa, our men in Africa cannot stand up when it comes to the health of the girls, their sisters, their mothers, their daughters, their cousins, and their aunts? We count for the 50% of population in this world, yet we are disproportionately abused within our right. So we have a disease that is a cervical cancer. We have a vaccine for it. Let's work and do everything in our capacity to eradicate that disease. And I call on all the leaders in Africa to implement the vaccination and to do it in a way that it also reach the villages, the far rural area, because they have to be also treated. And now today I want to thank the brave advocate and survivor who use the power of their voice, like Daniel, Gita, Aiko, Karen, Kim, Marcella, Natasha, Riani, and Sally. And thank you to the many others that join around the world. This is something that we can heal. It's not like when HIV/AIDS come and we don't have a vaccine. There is a vaccine to prevent this. And there will be no excuse, not only talking. We need and we want and we demand from our leaders in Africa, all over Africa, to deliver for the young girl, the young adolescents, and the young women of our continent, even for our mothers that have cervical cancer. That have been said, I want to leave you with a song called Kelele, in which I'm talking about the importance of education. Not only education for girls, but also for men to understand that their fate and their future is bright when the future and the fate of a woman is bright. Thank you.
Aburo me mojarella katishe ojame. Aburo me mojarella katishe ojame. Iwani amola omo baba. Iwani amola omo baba. Iwani amola omo baba. Laroni mola shishe. Baba, kelele, kelele, oh kelele, baba wa. Aburo me mojarela, katishe ojame. Aburo me mojarela, katishe ojame. Iwani amola omo baba. Iwani amola omo baba. Iwani amola omo baba. Laroni molo shishe. Kelele kelele. Kelele baba wa. 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 Ba ba jeni logun odun rere. Ah ba jeni logun odun rere. Ah ba jeni logun odun rere. Ba jeni logun odun rere. Mama. Omo baba, iwani omo ola, omo baba. Whoa, hey, 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 hey. Oh, kelele, kelele, kelele baba wa. Kelele, kelele, kelele. Aburo mi mojarella, katishe ojami. Iwani omo ola. Omo baba, iwani omo ola, omo baba. Whoa, hey, 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 hey.
Thank you, everybody. Your Excellencies, if you're still here, and for all the people who've been part of this, thank you very much. We now have our marching orders. It's time to move forward now. Let's go and implement. Thank you for being here. And you've got a strategy now. It's available online. Let's go off and save lives. Thank you very much for joining us.